Welcome back, Richard. It's good to see you this morning, sir.
Morning. How are you doing?
I am doing well for this. This is the last week of
Oh,
May. And as you know, May was Mental Health Awareness Month. And we've
right.
mentioned it a
Mm,
few times over the past month, the past few weeks. But we're going to spend the next couple of podcasts talking specifically about just mental health in general. Just in honor of the wrapping up of Mental Health Awareness Month. We're going to talk about it sort of in general terms, reviewing some things that we've talked about before in past podcasts, but just kind of bringing some things up to date.
right. And Mental Health Awareness Month has been around for a long time, since
I
1949.
didn't know that.
I didn't either. I thought it was more recent than that.
Yeah.
So this is not a current politically correct woke sort of thing. Mental Health Awareness Month has been around since 1949. It was originally designed to highlight the importance of mental well-being, to educate the public. And I think at that time, in those years, to reduce the stigma
Hmm.
that was attached to mental illness for a very long time,
Right.
people with mental illness were stigmatized. We still had institutions,
Hmm.
some of them not so good,
Yeah.
and we would just sort of hide people in institutions who were mentally ill. Um, and so I think that was a large one of their goals was to reduce the stigma,
Right.
but also to promote support for those affected by mental health conditions. That would be not only those affected directly, but also their caregivers and family members. Okay.
Absolutely. And I think that that point is often missed because
Mm,
so much focus is often given to the person who's struggling with mental illness, and that makes sense.
right.
But often the family and caregivers, they really struggle um,
Right.
because the sort of the experience of mental health and one of the things that people often say about mental illness is like it's very real, but it's often unseen. You can't
Mm,
see depression. It's not like a broken arm or
right.
where there's those physical traits that you can see. These are unseen, and so it's really hard because you look at them and they look perfectly
Yeah, they look
intact
normal.
and
Mhm.
and healthy, but yet they're struggling with these internal issues so strongly.
Right. I did epilepsy work for a long time, and it was called that invisible disorder, because you don't know. And many people, I was at a trial one time, and one of the persons there said his mother had epilepsy, and he didn't even know it until she was an elderly woman. He was taking care of her. He never knew she had epilepsy.
Yeah.
Um,
Well, in the same way, I had a kid that I worked with for a while. He's in high school, and he was living with his grandparents, and he really struggled with this really strained relationship with his mother. And he knew that his mother had bipolar disorder, but he didn't, nobody had said anything to him about it. And so, our first session was really just spent with me explaining what bipolar disorder is. And we ended that session with him saying that explains so much. And it completely changed his perspective. And so when I saw him the next time, he was like, I feel like now I understand things. And so he's not getting as angry. He's not as frustrated with her and
right.
feels like he understands her better. And so, yeah, you have to do a lot of psychoeducation with family members on just what is going on.
Right. And so that it traces back to 1949. Now,
Right.
what we want to do in these two podcasts, this will be a two-part podcast, is sort of talk about the current state of affairs, and what some of the problems are, some of the challenges, the pitfalls, the obstacles in the world of mental health, and then give our perspective on some of these things and what we think will help people think more clearly, more accurately about mental illness. So if you think of this in three parts, we'll do probably two of them today and one later in the week.
Yeah.
One of the things that we want to talk about is what are the numbers? It's good to talk about what are the dimensions of the problem. And we have said this many times before, about 20%
Mhm.
of any given population um, experiences some sort of mental illness during the course of a year.
Right. And I
So,
think it's important as we're talking about this that we're differentiating mental illness, mental health symptoms, distress. All of these are different ways that we talk about our experiences with mental health conditions and our overall mental wellness. And so it kind of is a little bit of a moving target, I think, for people sometimes because we talk about, 20% of people experience mental illness in a given year, but yet 1 in 20 US adults experience a serious mental illness each year. And so, well, okay, so there's milder mental illness and there's more serious mental illness. And then, and then we can talk about mental health conditions in younger populations. We'll talk about that as well. But there are varying degrees. And I think that, even as you're thinking about or talking about mental illness, it's also important to recognize that we all experience mental health distress sometimes.
right,
Um, you know, yes, 1%, 1 or 2% of the population may experience a particular condition, but all of us may experience symptoms from time to time. When a loved one passes away, we may experience depressive symptoms, but we don't all have depression. And
that's
so,
right.
when you're going for an exam or you have to present information in front of your boss or, in front of a group of people, you may experience anxiety, but you may not have an anxiety disorder. And so, there are these varying degrees, and so just be mindful of that as we're talking about these statistics.
That's right. And that's one of the things we want to stress throughout both talks is that there is this huge difference. And I think we're clouding that difference. I think that's one of our problems is we're not differentiating. And that's one of the things we want to talk about in just a couple of minutes
Yeah.
is differentiating these things. So about 20% of adults, about 1 in 20 experience serious mental illness.
Hmm.
We'll talk about that. 1 in 6 youth, so again, close to 20%, but most of them, about half, never receive treatment.
Right.
The other thing to remember, and I think most of us forget about this, is about half of all mental illness, lifetime mental illness, begins by age 14
Right.
and 75% by age 24.
Right.
So these diagnosed mental disorders,
Hmm.
the things that get you to a professional,
Hmm.
occur very early in life. They occur during the teenage years and
Hmm.
the early adult years.
Right.
It's rare to develop serious mental illness in your 40s, for
Right.
example, just for it to appear out of nowhere. They
Right.
usually appear in teenagers and young adults. Um,
Absolutely. And we typically consider the earlier they start, oftentimes the more chronic, the more
right.
pervasive that they will be. When you have a really young child who
Mhm.
has some of these, serious signs of serious mental health conditions, those tend to be more persistent over time and tend to be much more difficult to treat. Whereas things that come, a little bit later, it's a little bit easier to treat. That's not always the case because something like schizophrenia, for example, typically shows up in the late teens, early 20s, and
Right.
and that too is like a really difficult condition to treat. But generally speaking, when you're talking about depression or anxiety, if a person starts to experience those symptoms sort of in a way that it impairs functioning early in life, like during childhood or middle school or something like that, it tends to be more difficult as time goes.
And obviously, this makes it difficult because the teenage years are difficult anyway.
Right.
So the challenge is, am I just dealing with normal teenage behavior, or am I looking at an emerging mental illness? And sometimes it's very difficult to differentiate those two.
Right, because you just mentioned 1 in 6 youth have a mental health condition,
Right.
but one in five high school students have seriously considered suicide. And
That's right. You see
so,
that's a 20% figure, and you
yeah,
wonder, wow, 20, one in five high school students seriously, not just fleeting, like many of us can think about it, but
yeah,
they are seriously considering suicide.
right.
This is an alarming number.
I think that a lot more have fleeting ideas or
Sure.
temporary, what we call transient thoughts
Right.
of suicide.
Mhm.
But yeah, these are serious considerations. And
Right.
so, again, as we kind of alluded to in a moment ago, we're differentiating between sort of transient symptoms, periodic symptoms that come as a result of something that's happened in our life. If you lose someone close to you or a serious relationship ends, then you may have some depressive symptoms. That's one thing. But when we're talking about mental health conditions, we can kind of divide it into two broad categories. One is just sort of
Yeah.
any
Mhm.
mental illness, from ADHD to depression to anxiety, those kind of things. And then there's, serious mental illness. And, when we talk about serious mental illness, we are talking about symptoms or conditions that don't really respond to treatment very easily. We're talking about things that have serious influence on your overall functioning and often impair your ability to do things. Um, I mentioned schizophrenia a moment ago. There are people with schizophrenia who generally function okay. As long as they take their medication, many of them can work. They have relationships and things like that. But then there's another group of people with schizophrenia who have serious symptoms that impair them and prevent them from being able to function in their day-to-day life, and they need a lot of support. Recently, uh, RFK, Robert Kennedy Jr., in his conversations and presentations about autism, kind of fell into this um, uh, pit. He made him he misspoke. I hope that that's what it was. It was a misspeaking. Where he said that people with autism, will never function normally. They will never have relationships. They will never be able to. These are people. I think he said something along the lines of, "These are people who will never play baseball. They will never have relationships. They'll never be able to live on their own.
Mhm.
Um, they'll never graduate high school." And no, that's not at all true. There are many people with autism who have live wonderful lives and have relationships and have great jobs and play baseball and do all those things. There is a subgroup of people who are seriously impaired and have great difficulty and need lots of support and everything throughout their life. But so we have sort of these two categories of you know, any mental illness, that's sort of the broad category. And then you have those with serious mental illness. Those are sort of a separate group that are seriously impaired.
Right. And so he was confusing the two.
Right.
I mean, when you make a statement like that, he was sort of talking about autism as though it's a serious mental illness. And for some people, it might be, but for
Yeah.
many others, it's not. So when you
As though
think,
it presents only one way,
right, that's
and it
right.
doesn't.
So when you think about it, when you think about mental illness, we generally divide them into any mental illness, usually the milder ones, and then there's serious mental illness. But we're adding a third. I mean,
Right.
we're kind of adding a third with no mental illness. I mean,
Right.
that what we're saying is sometimes it's not mental illness. And I think that's the narrative that we want to keep emphasizing here, is that you can talk about these two groups, mild and serious, but we need to consider this third, that it's not mental illness, it's something else. Now, any mental illness,
Mhm.
you're talking about behavior, mental, behavioral, or emotional disorders. Okay, it
Right.
can be any of the three. Um, they vary in impact from very little mild impairment. For
Mhm.
example, many people have all of the symptoms of ADHD and technically meet criteria, but they function. I think Mel Levine, a famous pediatrician, probably had ADHD, but he was a brilliant pediatrician who wrote books, developed programs, trained pediatricians for years. He probably had ADHD, but it didn't impair him in any way.
Right.
So you stop short of making the diagnosis if there's no impairment. If it's
Well, right. But I think that, and I think we're because that's a really good point that what happens is, and maybe this is we're kind of teasing apart between any mental illness where things are mild and don't have as serious of an impact on one's life versus no mental illness. And I think like that difference is you see that in adulthood more often because what we're talking about, if you want to use Mel Levine, he may have had ADHD, but it didn't have a significant influence and impairment in his life.
right,
But that was because he designed his life that way.
right,
If you take that pediatrician and the way that he functioned in his life, and you put him, in the world of accounting, or
right, or
if he had
dentistry,
specialized in dermatology or something like that, those symptoms probably would present very, very differently, and then you probably would see an impairment. And
right,
so, as we get older, this is something we talk to kids with ADHD and parents of kids with ADHD a lot, is that as you get older, you can sort of curate your life in such a way that the symptoms have milder and milder influence on your overall functioning
mhm,
because yeah, you're not going to take that class. You're not going to go into that profession because that would not be good for you. Like there are lots of physicians who have ADHD who work in the ER or
right,
emergency departments or as pediatricians or as something where they're constantly moving and constantly shifting from thing to thing. They're not, people who are doing again dermatology or things where they're, sedentary and you're meticulously going through over someone's skin to look for concerning
right,
marks. So yeah,
right. So those are the mild men, and certainly the majority of people
right.
who have a mental illness, of this 20%, most of them, about 15%, have a mild or what they call any mental illness.
Mhm.
Then there are these serious mental illnesses, and this is where we're talking about serious functional impairment.
Right.
Um, it's that these are mental, behavioral, emotional disorders that have serious impairment, and it really is a substantial interference with your life. There's interference in your life, or it limits you in major life functions, major life activities. And these are people who need an intense level of care. Probably they need to have supportive care, medication plus supportive care. So with these, we're talking about 6%.
Mhm.
And in teenagers, and again, remember we talked about these things appear in teenagers. In teenagers, about 50% have mild mental illness and about 20%. And so it's much higher. The rates of serious mental illness are much higher in teenagers than they are in the overall population.
Right. And that should make sense for the reason that I was just mentioning that, when you are living your life in such a way that, every person is supposed to be doing exactly the same thing. Think about elementary school. Every fourth grader is expected to do exactly the same thing as every other fourth grader. I mean,
Mhm.
we try to do some variability and some individualization, but typically speaking, all fourth graders are supposed to be doing the same thing.
Right.
That continues throughout much of adolescence. Now, when you
Mhm.
get into high school, you can have some differences in your electives and things like that, but every high school student has to take algebra. Every high school student has to take English one,
Right.
2, 3, and 4. They all have to take biology, all geometry. They have to take all those classes. And so you're in this situation where no matter how good you are at schooling, you have to do it.
Mhm.
No matter what's going on in your life, you have
Right.
to go to this place every day for 180 days a year. And of course, that's going to result in some significant, you're going to have much more difficulty managing some of those symptoms. And so that the percentage significantly increases.
Right. Right. So, so one of the problems, so what we begin with is you have these 20% of individuals with mental illness, 5 to 6% have serious mental illness. But there are additional problems with this, differentiating among, is it mental illness? Is it serious? Is it mild? Is it perhaps no mental illness? In addition to that diagnostic dilemma, there's one other problem, and that is access to services. And this is something that everybody in this who's either involved at any level in the field of mental illness has to be concerned about access to services because many people, we saw earlier that half of teenagers don't get services.
Right.
They don't get services for their mental illness. So one problem is having any insurance at all. Okay,
Right.
that's a major obstacle, is that there are many, many people who simply don't have insurance that will cover anything.
Right.
Florida, we live in Florida. Florida happens to be 45th in adults who have a mental illness who are uninsured.
Right.
And therein lies a huge problem because where do we get these numbers? How do I know that 20% of United States adults have mental illness? Well, I get numbers from clinics.
Right.
If somebody goes around the country and they get all these numbers and they say, well, this is what it looks like. Well, the problem is if you don't have insurance, you're not going to seek services
Right.
and you're not going to be counted.
Right.
So we say 20% because that's 20% who are coming in for services. It could be much higher than that, all
Right.
right? Because many people don't have insurance. Medic, if this has something to do with Medicaid, but we all know that insurance is difficult to get because
Right.
we have a um, employer-based insurance world in the United States. And if your employer doesn't offer you insurance, you don't, it's very expensive to get on your own.
Right. Yeah, that was the next point is that, just the cost of insurance and the cost of services.
Right. That's
It,
right.
it is expensive
Mhm.
to and the way that the system is set up, it maintains the high expense for these things. I mean, if you want to go see a psychiatrist, you're talking about, up to $300 or $400 for an initial visit. And
Right.
if they don't take insurance or you don't have insurance, that's a hefty,
Most people can't do that.
yeah.
Mm,
And
no,
so, and you don't really, even regular therapy, therapists who take insurance, for example, but then they also see people who are self-pay. We do that here in our clinic. You know,
right.
we are kind of tied a little bit to where we can't lower prices for self-pay patients because that's what affects the reimbursement rate from insurances, because insurances will say, wait a minute, we're paying you this amount, but you're
Right.
offering the same service for this significantly reduced amount. If the services are really only worth that much, then we're only going to pay you that much.
Right.
And so
Yeah.
then it just brings all of the reimbursement rates really low. And so you're kind of tied. And so the cost of insurance for the patient, but as well as the cost of insurance for, the clinics and the providers, sometimes that is a significant barrier to treatment and to accessing services.
That's right. So the first problem is you can't get insurance, and if you want to buy insurance, that's what the Affordable Care Act was about. Was if you have to buy it in a marketplace, you have to pay for it yourself. It's very expensive. The other problem is something called parity.
Hmm.
We readily insure physical illness. We do, we don't readily insure mental illness.
Right.
Many policies have great coverage for physical illnesses. You can have surgery and you can get
Right.
medications for diabetes or you can get treatment for cancer, but they don't have equivalent services. And in some companies, I think this happens in Florida, your physical health insurance will be provided by one part of a company, and your mental health coverage will
Mhm.
be provided by another part of a company.
Right.
And those two things could be very different. Though they offer both, but the insurance for one is much better than the insurance for the other. So we don't, in our country, I think, we don't do a good job of insuring mental health, of paying for mental health services. Okay.
Right. I think the another major problem, we refer to this as a problem regarding access to services, and
Mhm.
it is the actual access to treatment. In
That's
an
right.
area, there are lots of therapists and counselors in our geographic region where we live, but there
Mhm.
are very few psychiatrists who work with children.
That's
Um,
right.
there's just a handful, four or five. And when a patient, we can see a patient who has some serious concerns, serious symptoms, a child or a teenager with serious symptoms. If they're under the age of 16, if you're lucky, 18 usually, um, you have just a couple of people that you can choose from. And when they call, they're often scheduling months and
Right.
months out.
Sometimes 6 months later,
Yeah.
6 months out. So,
So I had someone call the other day, and the psychiatrist is scheduling out until like September or something like that already. And so you have a person with serious mental health conditions, but they can't even get the psychiatric treatment that they
right,
need for months down the road. And there's really not, other than just bringing in more providers, and there's not really a system specific for that.
right,
There's no way to even increase the amount of availability
right.
in some areas.
Yeah, I think psychiatry is the one area where there's a dearth of service of psychiatrists. They're just in very short supply, at least in this area. Um, Same thing with special education services.
Right.
They vary from county to county and state to state. Some states have really robust special education services. Other states don't because of funding limitations. Um, we talk about, I didn't realize this, that Florida is 23rd in per capita income. We rank 40th in access to services. We rank 45th in uninsured. We are 40 out of 51 in access to services. We're 23rd in per capita income. And I've always said, for as wealthy as Florida is, you would think that our mental health services
Mhm.
would be somehow comparable, that we would be in the 20s in providing services, but that's not the case.
Yeah.
So despite the fact that we're a fairly wealthy state, we're 23rd in per capita income, we're 40th in access to services, which
Right.
is that needs to be addressed.
Yeah.
The other states lower than Florida are Arkansas, West Virginia, Tennessee, Georgia, Arizona, South Carolina. Mostly these are all southern states,
Right.
and the southern states just don't generally don't provide the
Yeah.
kind of services that we receive elsewhere.
And I think that the last barrier to services and that we'll mention here and before we wrap up is the shift that has happened that takes us, I think here in the United States, especially, many times we want quick fixes.
We want
We want to get, what's going to make this go away, and I just want to do that, and then we can move on. Therapy is not mental health treatment in general, including therapy, is not a quick fix. Um, there's not something that's going to make it go away
Mhm.
fast. And I mean, if you think about, you have a very close loved one who passes away, and they pass away later that day. You go talk to somebody, and you're sad about them passing away, and they just say, "Well, you just got to stop thinking about it. You just got to move on." Well,
Right,
you can't. You
right,
can't just stop feeling that way.
right,
It takes time, and what we have shifted to because of that perspective, that urgency that we have to just fix the problem real quick, is we've shifted to this idea of, well, all of this is in the brain, so let's just give them medication.
right,
And I can't tell you how many times people come in and say, well, I just have a chemical imbalance, and so I just need medicine to
right, right,
balance my chemicals. Well, no, it doesn't work that way.
right,
It would be great if it did, but it doesn't. You can have 50 people come in with bipolar disorder, and all 50 of them may need different medication
right.
combinations or medication
Mhm.
treatments. They all may need different types of psychotherapy services, because we don't, it's not like diabetes or heart condition where
Mhm.
we can pinpoint where the problem is and target that treatment. It
Right.
doesn't work that way with mental health conditions.
That's right. And that's another big issue. We don't want to pick on big pharma. This is not about beat up on big
Right.
pharma, but and we're going to talk about this in more detail in part two of this podcast, is that there was a shift in the 1970s and 80s of thinking about mental illness as a brain disorder.
Right.
And so now that's where you get this combination of, if it's a brain disorder, let's treat it with medication.
Right.
And that is has not been a solution.
Right.
And that's what we want to emphasize in part two of this podcast.
Right.
We'll pick that up when we get together for part two.
Absolutely. So that will wrap it up then for today. So
Mhm.
all right, and well, excited about this next conversation.
Right.
So until next time, stay happy, stay healthy, and forget to be afraid.